What causes hip flexor strains? If you have ever wondered what causes hip flexor strains, you are not alone. These injuries can be quite common, especially among athletes. Let's break down the key factors that lead to these strains. Hip flexor strains happen when the muscles that lift the knee and bend at the hip are overstretched or torn. These muscles are essential for many athletic movements, making them prone to injury. One major cause is overuse and repetitive motion. Activities like running, cycling, and dancing requiring frequent hip flexion. When these movements are repeated too often, they can cause micro-tears in the hip flexor muscles. This can lead to fatigue and increase the risk of a strain. Another cause is sudden movements or trauma. Rapid actions like sprinting from a standstill or making quick changes in direction can stretch the hip flexors beyond their limits. Additionally, direct impacts during contact sports can also result in acute strains. Prolonged sitting can contribute to muscle tightness. When you sit for long periods, the hip flexor muscles remain contracted and shortened. This tightness can make them more vulnerable to injury when you suddenly engage in high-intensity activities without warming up properly. Muscle weakness and imbalances play a role as well. If the core or gluteal muscles are weak, the hip flexors may have to work harder during movement. This overcompensation can increase stress on the hip flexors, raising the chances of a strain. Muscle imbalances, where some muscles are stronger or tighter than others, can lead to improper movement patterns that strain the hip flexors. Inadequate warm-up and conditioning is another factor. Failing to properly warm up and stretch before sports or training leaves the hip flexor muscles unprepared for intense activity. This lack of preparation can lead to sudden strains, especially in sports that involve high knee lifts and explosive movements. For those pursuing a career in strength and conditioning, understanding these causes is vital for injury prevention. Implementing targeted warm-up routines, flexibility exercises, and strength training can significantly reduce the risk of hip flexor strains. Conditioning programs should focus on hip flexor mobility and core stability to support athletic performance and minimize downtime due to injury. In summary, hip flexor strains arise from a mix of overuse, sudden movements, muscle tightness, weakness, and inadequate preparation. Strength and conditioning professionals must integrate injury prevention strategies to maintain athlete health and career longevity.